Hi, I'm Cynthia Clark, and this is my presentation on three key themes from the book Patience Comes Second, Leading Change by Changing the Way You Lead, by Spiegelman and Berrett and published in 2013. I'm going to begin this presentation with a bit of a spoiler. Although Spiegelman and Berrett titled their book Patience Comes Second, the purpose of the book is really to improve the overall experience of patients. They believe that the most effective way to achieve patient-centered improvements is by improving the way you treat your healthcare employees. The premise for this book is that engaged employees work harder, are more loyal, and are more committed to the improvements of the organization. This employee engagement leads to improved patient satisfaction and outcomes, which result in improved finances for the organization. Spiegelman and Berrett offered many different suggestions for improving employee engagement. This presentation is going to focus on the three themes that really resonated with me. The first is finding a higher purpose, followed by creating a culture of caring, and hiring right and firing right. Let's begin with finding a higher purpose. What does your team really care about? So I got into healthcare as a respiratory therapist, and I can tell you that most of the therapists that I worked with did not get into healthcare because they were excited and loved giving aerosol treatments. Most of them had a higher purpose, whether it came from an experience that they had with their child or a loved one. So what is the driving reason that your employees chose this career? Dig deep. Talk to your employees, listen to their stories, and explore their higher purpose. Once you have a solid understanding of that purpose, you can move into the next step of tying these values into your goals and your improvement efforts. Every employee should understand why the goal is important and what they can do to positively affect the goal. Leaders need to help employees define their role. They should be able to speak to this whenever you do your rounds. Employees should be able to tell you the department's goals, the organization's goals, and what they are actively doing each day to meet these goals. One way leaders can assess their leadership skills is by asking their employees these questions. What are our goals? Why are these goals important to the team? Why are these goals important to you? What are you doing today to meet these goals? When leaders deeply connect their people with the organization's mission, vision, and goals, they will have a purpose-driven organization. This will give the employees meaning in their work because they will be connected to serving a higher purpose. So Suchman, Sloiter, and Williamson's book titled Leading Change in Healthcare introduced an interesting practice called empowerment evaluations. In their model, an outside evaluator came in and interviewed each of the team members to find out what's working, what's not. Then the evaluator compiled their findings and presented them to the manager, and this allowed the members to help share the future visions for the team. It also provides the leaders with feedback regarding the team members' perceptions and their challenges. So I'm proposing a similar approach that leaders can use in their tying of the employee values and higher purposes into their department's mission, vision, and goals. I would suggest that this interviewing be done personally by the manager. It does not have to be formal, but it does have to be purposeful. The manager can use his or her findings to build passion and meaning into the team's work, helping shape the vision and goals for the team. So moving to the second theme, creating a culture of caring. Whenever you find the need to change organizations' cultures, you need to realize that this will most likely be a long, slow, and arduous process. I like the way Kowalczyk explains organizational culture. The culture is not something to be fixed, nor is it a final destination. It is an outcome of how we do our work and requires changing one behavior at a time. So before we trek off on this never-ending journey, there are a couple things to consider. So Hicks, Sullivan, Sexton, and Adair found in their journey to change the culture of Duke Raleigh Hospital that they first needed to focus on building resiliency and positivity in their team. Boutros and Purdy define resilience as the ability to remain strong and persistent when pursuing goals despite obstacles and setbacks. Given this definition, if your team is burned out or starting from a place of low morale, you can imagine how this would affect their ability to engage in the pursuit of cultural change. You may want to consider looking into ways to build their resiliency. Hicks and others suggested engaging the staff in team building activities and creating outlets that allow employees to share what they do to refuel or fill their cup of joy. So now that your team is revitalized, fit, and ready to change, let's look at what makes up a culture of caring. I like how a recent resource defines it: a culture of regard in which staff treat each other positively. This aligns with Spiegelman's and Berrett's encouragement in this book for leaders to follow the golden rule, to treat others as you would want to be treated. I mentioned that leaders should follow the golden rule because according to Spiegelman and Berrett, this should come from the top down throughout the organization. Leaders should always lead by example. This culture of caring also aligns with Slookman, Sloiter, and Williamson's motto of relationship-centered care and administration. Some of the key elements in this practice require leaders to learn to be present, to listen attentively with the intent to understand another person's perspective, let go of the antiquated notion of managers needing to control their employees, and look at your interpersonal processes. How are you relating to your employees, your peers, and others? Are you building up your relationships or are you tearing them down? A culture of caring requires leaders to move beyond words and into action. Employees can tell when you are being authentic or when you're just talking the talk. If you can't care for your employees from your heart, you probably need to consider a career change. If you can care from the heart, but just need some places to start, you might consider looking at your employee as a whole person, not just an employee. Think of him as a son, a father, a brother, an athlete. What are they passionate about? What about an aspiring chef? Whatever the case may be. When an employee feels cared for, they are working from a deeper level of loyalty and engagement that comes from a deep desire to increase the value of their work. And isn't that really what we're trying to achieve? In the final theme, hiring right and firing right, we're going to start looking at hiring right. One of the most important steps in developing a healthy culture in an organization is to ensure that you are hiring people who will willingly embrace the values that the organization is seeking to build into their culture. You cannot just put butts in seats and then wonder why the culture is different than you envisioned. So when there is a shortage of qualified applicants, like we often have in healthcare, sometimes we are just looking for a warm body to fill that block in our schedule. We need to realize that this can backfire. we first need to look at the person's ability to fit in with the culture you're desiring to create. Clinical experience alone is not enough. If you've spent any significant time in healthcare, it is likely that you have encountered an employee that has excellent clinical skills, but is severely lacking in the personal skills department. Hiring right means making sure that anybody that you bring into your organization is capable of both. One way to do this is through screening employees for cultural fit. The last part of this is firing right. Nobody wants to ever talk about firing employees and how screening employees will reduce the number of employees who do not fit your organization's culture. But no matter how careful you are, some will eventually get through. Even when developing a culture, a just culture of fairness and safety, you need to be swift and clean with eradicating the bad apples so that they do not damage the engagement of the good employees and ultimately corrupt the culture of the organization. If you do not get rid of the toxic employees, they are likely to affect the performance of your good employees. According to Schabel and Bechtel, while hiring the right employees is critical to developing an engaged team, firing the wrong ones can be just as important. Now, I'm not talking about firing instead of investing in teaching and developing your employees. What I'm talking about is those employees who, no matter how much effort you put in, will not conform to the purpose, goals, and the values of your organization and your team's work. Sometimes the most effective way to show your employees that you care about them and get them engaged is to fire the employees that are bringing them down. Do not waste your organization's money by investing to improve employee engagement if you're not going to commit to getting rid of the cancerous few who are destroying the culture from the inside out. I can personally relate to how freeing and uplifting it is when a toxic employee has been fired from your department. If you have one of these in your department, cut them free and give your employees a dose of fresh hope for a better tomorrow. In conclusion, I want to sincerely thank you for joining me for this presentation. I hope that this served to spark some of your own ideas for how to find a higher purpose, create a culture of caring, and hire right and fire right. After all, by increasing the engagement of our employees, putting them first, our patients will ultimately reap the benefits. Thank you.